In this lecture, we're going to be looking at the 3 procedures listed at the bottom of Chapter 51. We're speaking on provisional coverage. Procedure 51-1 is fabricating and cementing a preformed provisional crown. So for this procedure, we're going to need some equipment and supplies. You'll want your basic setup, shell or bridge unit, composite resin mixture, your DAP dish, a spatula, crown and bridge scissors, low-speed handpiece, articulating paper with holder, some acrylic burrs, your rubber wheel, and temporary cement. With the dentist, we'll examine the prepared tooth for its size and shape. We'll select the preformed crown unit that best suits the area of this mouth. We're going to try the crown on and make any adjustments with our low-speed handpiece. We're going to do this outside the mouth. We'll mix resin as directed and fill the shell, making sure not to trap any air bubbles in the material. And then we'd seat the shell over the teeth or tooth and ask the patient to bite down gently. Here we're going to notice excess resin flowing from the shell into the margins and the contacts. We'll use our fingers to apply pressure to the buccal and lingual areas of the crown and remove excess resin after 20 to 30 seconds. From there, we'll lift the crown on and off the tooth until the resin has hardened. The time required for setting the material is approximately 90 seconds. We're going to do this to prevent the crown from locking onto the tooth. Once the material is set up, we'll go ahead and mark the patient's occlusion with the articulating paper. We can also use a pencil around the margins and contacts and adjust using our acrylic spurs, disc, and rubber wheel. We'll do this outside of the mouth. We'll finish the crown or bridge and then cement with temporary. From there, we'll check occlusion and make sure we always document our procedure. Procedure 51-2, we're fabricating and cementing a custom acrylic provisional crown. This is an expanded function. The setup we're going to need includes our basic setup, a spoon excavator, our alginate impression that we should have gotten before we prepped the tooth, a separating medium, cotton rolls, self-curing acrylic resin, a spatula, scissors, surgical knife, burnisher, straight handpiece and mandrel. We'll have some finishing diamond, disc, or burrs, polishing disc or burrs, articulating paper, pumice paste, lathe and sterile white rag wheel, and then our provisional cementation setup. Steps include obtaining the alginate impression of the arch before we're going to prep the tooth. Check the impression to be sure that it's free of debris and tears. We'll disinfect that impression and then we're going to keep it moist while we're prepping the tooth. We'll isolate the prep tooth with cotton rolls to maintain moisture control. Apply petroleum jelly or a liquid medium to the prep tooth to facilitate a separating medium. We'll use a small spatula to blend the powder and liquid into a homogeneous mix. Set the mixed material aside for 1 to 2 minutes until the resin reaches a doughy, less glossy stage. We're going to unwrap our alginate impression. We'll gently dry the area of the tooth or teeth that we're going to provide coverage for. We'll remove the resin from the mixing container with a small spatula and immediately place that into the area of the prep tooth or teeth. We'll place the acrylic loaded impression back into the patient's mouth, covering the prep tooth or teeth. Allow the material to reach an initial set, which takes about 3 minutes, and then we're going to remove the tray from the patient's mouth. We'll carefully remove the provisional coverage from the alginate impression and place it onto the patient's tooth or teeth. We're gonna mark the marginal border and contact points of the provisional coverage with the pencil to provide better visualization of the markings. From there, we're gonna trim the acrylic with a 1 millimeter, within 1 millimeter of the gingival shoulder. We'll check the occlusion for accuracy and completeness of the provisional coverage and make adjustments as needed. Remove the provisional coverage and take it to the laboratory. This is where we're gonna polish with the rag wheel. And then we'll temporarily cement the provisional coverage with the temporary cement. We'll check occlusion with the articulating paper. If reduction is required at this point, the dentist would use an acrylic trimming burr, and we'll always document our procedure. Procedure 51-3, we are fabricating and cementing a custom acrylic provisional bridge. So our setup again is going to include our basic setup, spoon, thermoplastic tray, cotton rolls, auto cure acrylic resin, the syringe type, a spatula, scissors, surgical knife, burnisher, straight hand piece and mandrel, finishing diamond, disc, or burrs, polishing disc or burrs. We'll have articulating paper, some pumice paste. We'll have our lathe and sterile white rag wheel, and then our provisional cementation setup. The thermoplastic tray is prepared from a cast before the scheduled appointment. We'll isolate the prepared teeth to maintain moisture control and lightly apply petroleum jelly or a liquid medium to the prepared teeth. We'll prepare the provisional material cartridge for application. Express the acrylic resin from the cartilage directly into the tray, and then we're going to place that loaded tray back onto the prep tooth or teeth. We'll allow the material to reach an initial set. It's going to take about 3 minutes. From there, we'll remove the tray from the patient's mouth. We'll carefully remove the provisional coverage from the tray and replace it onto the patient's teeth. After the final set, we're going to remove the provisional and mark the marginal border and contact points. We'll trim the acrylic resin within 1 millimeter of the gingival shoulder of the prep tooth with our acrylic burr or stone. We'll check occlusion. And then we'll remove the provisional coverage and take it to the lab where we're going to polish. From there, we can temporarily cement the provisional coverage with our temporary cement. We'll check occlusion again with articulating paper, and if we're needing an adjustment at this point, the dentist will use an acrylic trimming burr, and then we'll always document our procedure.